next to ameliorate the suffering and ensure a just recovery for all. So we hope that you can see the slides. We invite you to use the chat box. We can unmute your lines at various points throughout the evening. And this is the general plan for tonight's webinar. So our welcome updates on COVID-19. So latest news, a lot has been going on, pressing issues. We'll talk about the second wave and how can Ontario be better prepared. What actions are needed to ensure that we have a just recovery for all. We'll have time for questions and answers throughout. And if there's time, some updates on health system transformation. And we always want to leave with some calls to action and hopefully a cheer. So welcome everyone, and I'll turn things over to you, Doris, to get us started.
Thank you so very much. I always take a different take, it seems. You said a lot of things happening, and I would say not enough has been happening. So here you go for a start. So it all depends what you look, right? I mean, it's actually very apropos of life and what's happening in the world, especially if you look south of the border. So a lot is happening in many ways, and not enough has happened also in many ways. And perhaps we will start with that. So let me start at the end, at the fact of why I am saying it. Today, as I was attending and listening to the Premier's presser, I was so hopeful that he will announce that we are putting additional restrictions in Toronto, Ottawa, and Peel. Peel is a bit of more of a question mark, but Toronto and Ottawa are absolutely not a question mark because the public health officers of both Peel, of Ottawa and Toronto are actually pleading to the government to put higher restrictions because the public health officers locally cannot do that by themselves. They don't have the authority. And in fact, Dr. De Villa said that if she were to just cross the boundary more than what she can by herself, she will be personally liable. So you can understand the pressure. So on one hand, you have the public health officers of both Toronto that said we need more restrictions, and we can send you the link to the press release from them on Thursday or Friday it was. And then of Ottawa, basically, Dr. Vera, I called her, saying that Ottawa is in crisis not only in public health, but also the hospital sector. Remember, Ottawa has less hospitals than Toronto, even though the population is smaller, but if things get very out of hand. To complicate things even more, we are now aware that, that Toronto and Ottawa cannot do all the contact and case tracing, not only because they don't have the people, but actually because it appears the province didn't purchase sufficient testings. So when you, Susan, say, how can we ensure a just recovery for all? I sit and I shake my head because for all of those of you that look at tweets, I just tweeted about an hour ago or 2 hours ago, how is it possible with hospitals, with all due respect, and we all respect hospitals, there are already several of them, if not many of them, delivering the flu shots for their staff and patients, and yet nursing homes are not, right? So when I get the explanation, well, nursing homes need to get, you know, the consent from the family or from the resident, we could have done that 2 weeks ago. You don't need to have the flu shot on site to actually get the consent. So my biggest fear, colleagues, is that, and I hope that will not be the case, that we have a repeat of wave one, likely not in relationship to PPE, but in relationship to flu shots. Who comes first, who comes second? I also heard that there are a couple of additional shelters that are in an outbreak. So again, where are the flu shots for them? We are talking as nurses and others that are listening within this almost 200 people here. I'm sure there are from other professions too, who gets the flu? Who gets COVID? You know, that this is not magic, and this is not fantasy land, and this is not fear mongering. This is reality. You know, you and I have the space to live with 1 or 2 or 3 more people. Families that have less capacity, people that are in shelters, residents that are in nursing homes, they are in much more compromising situations just because of how they live. So if we are not going to give them first the flu shot, we are going to be in big trouble as a society. We are going to be in big trouble. The good news is that there likely will be less flu than in previous years, simply because we are all finally brainwashed in a good way. I'm saying brainwashed about the hand washing, about the distance, about the sneezing in your sleeve, not in front of everybody, right? And on top of that, about the mask. And the good news is that the Premier did put now the masks as mandatory, a bit too late, but nonetheless. And I say too late because many municipalities move ahead by themselves, right? And so we had most municipalities already complying. But this is a very important message from the Premier to differ from his counterpart in the US, right? That, you know, here the Premier does use the mask, tells his people to use the mask, says it's important to use the mask. And those are not light messages. Those are very important messages. We just wish at RNAO, and I know many others at Ontario Hospital Association that have called him incessantly, CEOs who have called him incessantly, epidemiologists who have sent letters. Many of us are saying, Premier, that's good, not good enough. Every day that passes without announcing restrictions of phase 2 type of restrictions for Toronto and for Ottawa, and likely also for Peel, is a day too late, because it will be harder to recover from that and to get a grasp and a hold on this nasty virus that is in front of us. So with that, we are saying, and we launched that last week, basically a campaign. We are currently in red. You know, when you drive a car, if it's green, you keep going, right? You pay attention everywhere, but you keep going. If it's yellow, you're more cautious. If it's green, you stop. Premier, we are at a time when in Toronto, in Ottawa, and in Peel, it's time to stop, whether it is for 14 days, so we see one cycle, or whether it is for 28 days, like Quebec is doing, we got to stop. And RNAO has been asking even before that about closing of inside everything, closing inside bars. People want to drink, you know, you still can sell. Honestly, I buy the ice cream with grandkids that they give you through the window. I'm not kidding, it's true. And you can drink it in, you know, in a bench, or, you know, with social distance. You can still buy, I learned this one from Heather, let's see if I get it right and not in Spanglish. Curve pickup or something of that sort, around the curve. Heather, teach me again.
Curbside pickup.
Curbside pickup. You know, that you pick up around the curb, or you order from home, which what we do. So you keep the business going and you keep eating yummy things that otherwise, you know, you used to go and like. We can do all those things. We just need to stop the inside places where it's 10 people, 15 people, or 20 people. The gyms, I know it's people that we all know is people that are healthy, but enough one person that is not healthy, and then, you know, becomes a problem. Other inside sports. So let's keep pushing for that. I do believe we will see that happening, unfortunately, because of the numbers. We will see that happening, not only the pressure. And let's also keep thinking of our vulnerable populations, please, especially those in shelters, especially those in nursing homes. those in correctional facilities, the migrant workers that are still working and living in very confined places, right? And others in such predicament that supportive housing, for example, right? So we need to keep an eye, and we need to use the resources we have at hand. We need to use home care way more than what we did in the first round. Let's send home care nurses that are going anyways to do treatments to people with, you know what, the flu shot also, so that those people that are vulnerable don't need to be going out to another place to get the flu shot. And I know that home care agencies are eager to do more. Home care agencies are eager to do more. We all are eager to do more. Our students are eager to do more. So that's the other message for all of you to send out. We want to do more, not less, but we want to do it soon so we can get hold of what's going on. So retweet, 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 and Facebook and all of the other things that people do, please, because the message is getting through. Today, not inadvertently, I honestly was 100% sure that the Premier was announcing something. And I sent the tweet, Premier is about to announce, and then I put, I think in parentheses, I hope, and here it went into the media, someone else. Breaking news, RNAO is saying, blah, 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 right? So the voice of nurses is being taken seriously. Colleagues, we are at another stage with our profession and other professions. Let's give voice to the others too. But the PSWs and the residents and the nurses that are in those nursing homes need protection as much as anybody in a hospital. So next one, please, Susan. So this is important, and it's interesting because I was watching right before the Premier made his remarks to Dr. Tam, and you can see that piece on a tweet that I added, because I was having a little bite with my husband in between meetings, and Ricardo is saying, can't you not leave the BlackBerry for a second? I go, no, 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 because I need to send the tweet, Premier, please announce, please announce. And Ricardo says to me, but Dr. Tam is saying that it's happening. She wouldn't say it if it was not happening. I said, oh, I don't count the chickens until they hatch, right? So yeah, she said it. She said that Ontario needs to do more. She cannot be more direct. That public health officers are asking that. We're saying it. Everybody's saying it. Let's keep pushing until it happens, because if not, the pain will be longer. Next one, please. And another thing before, if you go to the previous one, I tip my hat to Dr. Tam. Here is real learning. Here is real learning. During the first phase, many of us were unhappy about the issue of starting too late, of saying, you know, is low risk. She was one of the ones that said, same as Dr. Williams here and many others. She was the one that took a long time to say masks are not sure. But guys, this summer, all along, the entire summer, she said every single day, the second wave, based on what was happening in Europe, she said it, the second wave will be more serious than the first wave. And the second wave, we need to be better prepared. And I don't feel that here at home in Ontario, we took her seriously enough. Not only on the issue that the second wave comes with also the flu, right? So it's the dual pandemic in a sense. It's also that everybody's tired. I mean, look at ourselves and picture those that are in the front lines. People are tired. And when people are tired, you have less, not lesser, because they're important people, but less energy in the workforce. And yet we did not hire. We begged every single nursing home. We begged the province. We begged Minister Fullerton to announce funding to hire for nursing homes. And that didn't happen till about a week ago, that funding was announced for 6 months. right? 6 months of top-up and a bonus for PSWs. Well, what about nurses? What about those directors of nursing that my team and I and many of you have been fighting that they also deserve the $4 famous dollars, the $4 that every other frontline received, because those directors of nursing are also frontlines. They were there day in and day out. So I respect and we respect that RNAO the bonus for the PSWs, absolutely, but everybody else deserves the same. Midwives deserve the same. They didn't get it, right? So the list goes on. So are we ready, Susan? A lot has happened? Kind of.
Well, there's been a lot in the news, not necessarily proactive action.
Exactly. And we need to make sure it's proactive, right? So I think that our President Morgan offered is on the attendees, but she said efforts must be taken immediately to ensure we have the resources in place and enough nurses and other health workers, especially in long-term care. Guys, this was said months ago. First, we did an action alert about the July 31st. Then July 31st was gone, and in case people don't know, but let's see if someone can get a win of the book. As long as it's not an RNAO member. No, that was wrong. Thank goodness Imagine didn't pay quick attention to that slip. But that is not an RNAO stuff. If someone can tell us why did we say July 31st and write it on the chat, the first one that gets the answer, Susan, gets a book. The book of the BPGs. So why was July 31st? Did we get an answer?
Waiting.
So why is it that our first action alert said, Minister Fullerton, we need the basic care guarantee by July 31st. What was happening on July 31st?
Juliet is saying that it's the height of summer.
Okay, that's nice.
TC says the Emergency Measures Act was ending. Moving into phase 3, says Ashley. Report to Justice Scalise, says Morgan. Now, which Morgan is that, though? Which Morgan is that?
No, cannot be our Morgan.
I'm not sure. To table a bill in the legislature to focus on long-term care from Kathleen Picard.
Okay, good. Kathleen Picard, Assembly Chair.
And yes, so that was
Kathleen,
so she wins. So Kathleen wins. So Kathleen, you need to send to the panelists your address and we'll send you a book.
So July 31st was absolutely that. Now let's ask this. What is this Gillis inquiry? Can anybody tell us what's the Gillis inquiry? Cannot be Kathleen again. That's another book. What's the Gillis inquiry? Going once, going twice, going last. Here we go.
Diane, yeah, Whitlofer.
Very good, Diane, perfect. The Whitlofer, we ain't going to say that name. You know who asked us? Actually was Justice Scalise. She asked us not to say her name ever again, not to give her fame. But you're totally right. That is what it was. So that's your second book. No more books, don't worry.
Okay. So that's Diane. If you can send to the panelists your address and we'll send you a book.
But you see, guys, took time until Diane answered. And this is the case because this is what happens with all these inquiries. They come and they go and then no one remembers, right? And now we have a commission and in a year, no one will remember. And the list goes on. And we don't need more commissions or more inquiries. What we need is solutions. And we need the solutions now, starting with the flu shot and doing then really the hiring of the basic care guarantee. So that is a must. And then we did the July 31st and nothing happened. And then we said hire in August and nothing happened. and the announcement came at the end of September for funding for PSWs, right? So a lot is happening, but a little bit too late, and still not enough, because we need more RNs, more RPNs, and we need the nurse practitioners, and we need the PSWs if we are going to have good results in terms of long-term care. So learn from the first wave. Well, read to the podcast of the front burner. It doesn't seem we learn a lot from their report. Make sure families are not shut out. Please, 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 please. Let's make sure, and Heather and Irma-Jean, I'm already getting letters from families fearful that we will shut down again, asking us for RNAO to please stand up for them. And we are going to stand up, because we cannot shut out families again, even if there is COVID in those homes. Because what happened in the homes for families and for the residents was too serious, and we cannot keep shutting them out. They are now essential caregivers, and what we need to do is to make sure they retain their title of essential caregivers and their rights. So that's the second. Secure enough health professionals. I know, yes, Morgan, you're right, but it will take a long time and good leadership, both from RNAO, from WeRPNs, from ONA, from everybody, and from the leaders in the homes, from the nursing leaders in the homes. And hopefully, quite frankly, we will have more and more operators in nursing homes that are nurses and understand. And we need to push together the agenda of permanent solutions and not band-aids. We say permanent solutions because during the first wave, we had Via Nurse. Now, who can tell us what's Via Nurse? Can anyone tell us what's Via Nurse?
So Doris, is this a book or not a book?
It's a book.
Pride. This is
It's a book.
A third book. So did you know that we were going to be giving away prizes tonight? Okay, so the question, just repeat the question one more time, Doris.
What is Via Nurse? Via Nurse. And did anyone participate in Via Nurse?
Just waiting.
That will be interesting. Going what? We will count till 5 only.
Okay,
One.
so Dawn says public health surge capacity deployment process.
Yep, that is true.
And Galaxy, I'm not sure who that is, but
only one.
Okay, so you're happy with the first answer?
That is correct.
Great.
So Via Nurse was and I say was because we closed it in purpose, and I will tell you why. Via Nurse is a site that connected, that nurses volunteer to, actually, why don't I tell Heather to share about Via Nurse? She was very involved with Via Nurse. Go for it.
Sure, I can talk about that. And so Via Nurse started March the 13th, I think, right after the pandemic was called. And we put out a number of surveys to ask the nursing community to indicate their availability and interest in helping to support what we thought at the time would be virtual care, case and contact tracing potentially, really not too sure. Within the first 12 hours, we posted it, I'll just say Thursday afternoon at like 4 or 5 o'clock. By Friday morning, we had well over 800 plus people that had responded. It was absolutely unbelievable. And so over the course of many months, we extended that request to include ICU services, clinical care, long-term care in COVID positive homes. And we're able to match hundreds of organizations with nurses who were within their communities and able to help support care delivery in a range of sectors. Quite outstanding. It was 24/7 for our membership team who looked at who was requesting, helping to support them put their requests forward, helping to match those in the geographic area with the needs that were being expressed. And it was a lot of work, quite frankly.
Lots.
We were able to really help support a huge number of connections before the government actually released their portal for Health Human Resources. So we were happy to do that. We're overwhelmed with the response from the nurses who came forward to indicate their interest in helping to support the cause, if you will. Really, it was just an amazing experience, but we did close it on July 31st.
And absolutely, yes. And I'm asking Olivia to post the RN careers. Thank you so much, Heather. And we closed it because it was, as Heather said, an emergency stopgap. It was a quick Band-Aid solution because government at the time didn't have their site ready. And because we already knew what we wanted to do, we were ready to go. And at the beginning, we thought, as Heather said, that it will be the telephone triage. Then we thought it will be the ICU nurses. ICU nurses, it didn't materialize in lots of them that were needed, but what did materialize is long-term care. And then it was so bad. And some people were going and then not going back again because they were afraid. Normal, you cannot judge that. If there was an outbreak. So then we did actually a component for homes in an outbreak. So we are not reopening that because we did ask, as I said before, my colleagues and I and everybody, we did ask in May, in June, in July, in August, in September, and up to this day, higher. We did write to government. We said put funding so they can hire, and not much happened, and therefore we're not reopening. But we do have, as all of you know, we have our own careers. So we have asked, and Daniel Lau, who ran Via Nurse from the membership department, just so you know, when Heather says 24/7, really they were 24/7. We could get a call or an email at 11 or midnight, and at 3 a.m. they already had people there, or the next morning. So we already asked, and Daniel is sending another email to everybody, and Heather, it will be good if you also tell TCers to put the names, and all of you colleagues, if you have extra hours, put your CV and put your name in our own careers. It doesn't cost nothing. You don't pay a penny, and employers will be able to connect with you, and hopefully you can serve them well. So Via Nurse doesn't continue. That was specific to COVID, but our own careers that has been there for 16 years, tremendously successful, is the largest job board, continues.
Doris, there are some questions in the chat box about staffing. Should we talk about those right now? Okay.
Yes.
So there's one question from a nursing student wondering if it's true that the Ministry of Health and Long-Term Care will decide sometime this week if only essential workers are permitted to work in long-term care homes.
What does it mean, only essential workers? That's news for me. But what does the person mean?
So I'm thinking, well, maybe you can clarify, but I was thinking maybe that meant some restrictions on students, perhaps? Okay, we'll let them.
I know that there is a table, meanwhile, that the person writes, there is a table.
She says that is what she meant.
Students?
Yeah, so are there restrictions on students being permitted to work in long-term care?
So I know that there is a table for students' placements, but it's for the teaching hospital. It's out of Tazan. And I don't think that they're putting restrictions on students. And the more tragic thing, wouldn't it be absurd if they put restrictions on students when they can be hired as PSWs? Right? But thank you for telling us, because I will check on that for sure. Maybe Heather, tomorrow you can ask Lisa and OLTC if they have heard anything on that, and we can clarify that quickly. I can clarify also through my blog, but I surely hope that no.
Mm-hmm.
Actually, okay, so I think this
Susan, imagine.
Yeah, I was going to say that the Canadian Association of Schools of Nursing has declared that clinical education is essential and students should be considered essential workers.
It ought to, because listen, we are already 8 months. If not, they're going to lose. Like, it's unbelievable.
Absolutely. Yeah.
I'm glad that you saw that, Imagine. Maybe you can put a link here, Imagine.
Yes.
Put
I
a
will
link in the
find it.
chat because people will use it.
Yes. Okay. Will do.
So there is a colleague here. Look, I am in a BSN program at U of T, and our clinical placements are happening this term. Here you go, from Julia. That's what I understood
Excellent.
too. The colleague that is an RPN, my internet connection is unstable, whatever that means. Then a colleague RPN, it's what is jumping, the questions are jumping and I cannot read it.
Yeah, lots of questions coming in.
Yeah, if working as RPN in LTC and completing BSN, you cannot complete placement in another facility. Well, because they're only allowing one facility, right? So that I would understand. They don't want people jumping.
Yeah, I think the issue is people that are doing their clinical placements in one organization can't work as personal support workers in a long-term care home. And also many of the organizations that are taking students at a decreased number of placements in order to preserve PPE, cohort the students, etc. So that's certainly something that I've heard directly from many organizations.
Okay, so we can clarify that more maybe, but ideally, my suggestion is still put in their in careers your CV. Doesn't need to be a long thing, 1-page summary. Obviously needs to have your email and your email at least, so they can connect with you, because I can see, give it 2-3 weeks, you will be flooded with requests. That's my view. Other questions, Susan?
Well, do you have anything to say about reactivating the emergency class RN? Like, you're kind of, do you have anything to say about that?
I believe that the college will. I don't see why they will not, right? The human resource needs will not be lesser than in the first round. I mean, one would hope that we were better prepared and will be lesser, but I'm not so sure for the reasons I mentioned before. Number one, because of the flu issue, right? Last time we didn't have that component. Number two, people are tired and exhausted, right? So, yeah.
And then there's a comment or question about international RNs who have so many barriers working in Canada and are kind of willing.
I have received numerous emails about that from international nurses that already had an offer here. And I cannot come now for a whole variety of reasons. The most important, the visa, quite frankly. From the college and the delays in giving them the approval, et cetera, et cetera, et cetera. So yes, I'm fully aware. And listen, internationally educated nurses, tragically, those that even live in Canada always have experienced barriers, always, including discrimination, but barriers too. And now there is a perfect storm of excuses, right? Whether it's the visa, whether it's the system is not fully up running and there are other priorities with the CNO until it's up running. And also our own people here that are looking for placements and for work, which is a true reality, right? So yeah, I can understand that because I see those emails, yeah.
Thank
And
you.
actually, Doris, I wonder if it's a good time to talk about the number of healthcare organizations that seem to also be letting staff go at this time, and
Yes.
new grads who can't find work again.
Yes, so let me start with several and give explanations, because I've been in touch also with several, both with the presidents of those organizations and in some cases with the chief nurses. So in some, it's a true replacement of RNs yet again. RPNs, and I'm not trying to offend here our colleagues that are RPNs, but that is an ongoing issue. On others is doing away with the number of positions altogether. And the third is replacement that is not because the president or the chief nurse doesn't understand the difference, etc., but it's because government actually is paying a lower fee, a lower funding per bed than is today. So the perfect example, and I don't want to get into the details, not to get that president and CEO in trouble, is an organization that did let go recently of almost 100 positions. When they got the additional beds in the last 3 years, the beds were at the beginning at $560. Now they're $750, and they still get the $550. So when I get a call from organizations that are that honest, what I do is I push at the government level, because you know the type of patients that organizations have, as you all know, are more complex. So the beds cannot, as if it's no patient there, the bed cannot be costing the same regardless of who is in that bed, so to speak, right? And whoever is in that bed requires the competencies, judgment, and skills of the appropriate care provider. And there is a space for RPNs when it's a stable patient, but the type of patients in many of the acute care places are very complex today, and in COVID even more so, right? So I don't know if that helps, Imagine, because I didn't see the question, but yes, it's a other questions, or we continue with the slides?
Well, just someone is saying they're a retired older nurse and they cannot do active frontline duty. What could they do behind the scenes to help? Lots,
right? And again, I suggest you put your name in the RN careers, and you can write a note. I mean, it should say they're retired, non-practicing category, right? I mean, first of all, many management roles are such, by the way, right? So you could be helping. Back office support, it could be helping. So there are many roles that are not a practicing RN. I mean, sadly, I say, because I don't think that any nurse should do that, or any doctor for that matter. Sometimes nurses, when they get in management and they do management for a few years and they decide, well, I will be on management the rest of my life, they give up their RN or their whatever registration, right, to save the money or whatever reason, right? So you can do a lot of things without the practicing RN. So don't discount your capacity and your opportunity to contribute, because the system needs you. So thank you for raising the question.
Doris, before we move away from staffing questions, one person, Kathleen, is asking for an update about Fullerton's promise to table a bill looking at staffing in long-term care.
Yes, the ongoing promise. I'm sorry, but you need to see some of the tweets. Well, Catherine, you see all the tweets, so I don't need to say you need to see the tweets. I am not impressed. I'm not impressed about Minister Fullerton these days, since the moment that in the legislature she used her fingers to say, you know, you don't slip your fingers and create stuff. Well, you do, Minister Fullerton, because actually RNs, RPNs, and NPs and PSWs are waiting to be hired. So yes, you do. So that's not an appropriate answer. My view is that this is a calculated delaying tactic, that what we will see now is the PSW and the new category. Imagine if you can look at that announcement of the government. I don't remember what is even called, an assistant to a PSW, an assistant to a PSW on the job training. That will be for 6 months for them trying to get the COVID situation a bit more under control with more people. And that in February, we will see two things. And let's see if I am good with my crystal ball. One is an interim report from the commissioner. It is my view we will see that. And also a report, not an interim report, but the final report on the staffing from Minister Fullerton, which will fit into the budget and will fit into elections. And that's my fear, because what happened last time is Kathleen Wynne approved 4 hours, as you may remember, 4 worked hours. She didn't stipulate RN, RPN, or any of that. Actually, they did stipulate 65 NPs, of which finally we are going to get now the last 15. That was in the announcements last week, but that's money that was with Deb Matthews even. And that then will be elections. And with Kathleen, what happened? You know what happened, changing government, and we didn't get the 4 hours. So it's the ongoing saga of nursing homes and why we as nurses and health providers, whether you are an RN, RPN, NP, PSW, operator, or frontline, or middle line, or the sideline, or family, or resident, the time is now and not in February. And we will keep going, and we will keep going, and we will keep going. And as things get worse in nursing homes, which already are, because follow, please, Nathan Stoll, and imagine you can write or Heather in the thing, his Twitter, follow him, follow Jacobob. You will get the statistics every day about the outbreaks transparently and for real about nursing homes. They're going up. The number of staff that are ill are going up. The number of residents are going up. And yet the staffing, nothing is happening. So something is wrong in the picture. And we will keep speaking loud and clear that we need the solutions now, not in February, as we have been saying for the last long time. And we will create a timeline of when did we ask first to 12, when again, when again, when again, when again, and put that in the mirror of every political leader so that they don't go then in the microphone to say how sorry and how sad and how this and how that they are, because I have developed a lot of trust and respect and belief that this premier was going to change things. But as I said the other day, that's very quickly fading away because I don't see no actions, and February is too late. So that's one piece. The second piece, in April, we will see the final report of the commissioner that again will say that there is a need for more staffing. You know, that's after the second wave. Nothing of that will save people or staff for that matter. So it gets me very sad and very upset. And I know it gets upset all my colleagues that work in long-term care and all the both at RNAO and otherwise. But that's what I see.
Actually, Doris, that was a community support worker not community, but a support worker for long-term care.
2 weeks,
they
right?
were provide 10 weeks of education, whereas it's 6 months for a PSW.
So it's a support to the PSW. So it's a push to the bottom.
Yeah.
It's a push to the bottom.
Yeah.
But that doesn't save lives.
No. They're called, supportive care worker. I'm sorry, supportive care worker.
Yeah, I say it's the Quebec model, right?
Yeah, with the 10 weeks.
Thank you, Kathleen. Kathleen Picard says we will keep pushing.
Yeah.
Thank you. They do deserve a lot more. They do deserve a lot more.
Once you're talking about PSWs, maybe one last question. There are some comments about PSWs have gotten acknowledgement and a salary increase. It's hard to take when you're a registered nurse and registered practical nurse, kind of, what about us? I
It,
guess
it
is the
is
question.
it is offensive. It is offensive for the premier to stand there and say how much we value PSWs. Say it, but also say, and nurses. At the very least, take that word out. You know what I mean? It's offensive. It's offensive in the way they speak about that. It's offensive in the way they don't recognize it financially. Why is it that the PSW will get 6 months bonus, which by the way, bonuses never have served, and RNAO has never supported them for nurses either, because the bonus is gone, the nurse is gone, right? But why is it that for PSWs and not for the rest? Like why? And as I said, the directors of nursing that were working day and night there, we know day and night. Why is it that they never got even the $4 an hour? Yeah.
Doris, there are a few questions in the chat box about payments and incentives. Do you want to answer those now before we move on? Or like there are lots of questions.
Yeah,
But,
ask, yeah. And
yeah,
we can all answer.
What's that?
We can all answer.
Yeah. So the question, oh, now I've lost it here.
Which one were you thinking, Susan?
Oh, well, I guess there was one, it was kind of adding to your question about PSWs. But looking at home care nurses getting an incentive because they're working at higher risk. And then like community health clinics not receiving pandemic pay. Do you have any comments about those kinds?
So nothing, not that I agree, but that's the reality. Nothing will change about the pandemic pay. Done, set in stone. Nothing, not a penny more will go into that. This piece of PSW is a new one because they needed to announce some staffing. Nothing will change. Hence why when ONA goes into negotiations, I don't know if any of my colleagues from ONA are there, but you can hear us. We are going to be behind you, pushing, because it's not fair. And the same should happen for RPNs. You know, if you look, a PSW with 6 months training and the bonus and the $3 top up will be making more than an RPN. Will be making more than an RPN. How is that fair? How is that fair? Or almost the same. 6 months versus 2 years. It's not okay. So, you know, governments try sometimes to do something good for one group, but they forget about the others. And then they're surprised that the others leave and go somewhere else.
And maybe, Doris, on a more positive note, there's a question about the public health nurses in schools, and were they hired and from where?
They are. So I will tell you because I've been in touch with several of my colleagues. Yes, they were hired. All of them are RNs. In some cases, because they didn't have an RN with baccalaureate, what they did is they put nurses with baccalaureate that are currently working in public health, in school health. They put in programs that are not in the schools, they put them towards the COVID piece. And then they put the new RN into those positions, but they were hired. Yeah.
And some from within,
so for
and
example,
some from without.
For example, Ottawa has all of their allocation already. And Julia, I just spoke with Julia today. They have their 50 already allocated, all of them. Yeah. Yeah. Well, all of them, they all are hiring. It's a good point you made, Irma. No, they all have the quotas that they got, they hire them. Whether they put the new hire to the school COVID piece, or they put someone else in that, and this one here, that might have been the case because they wanted to move them fast.
Yeah.
And they wanted the ones that deal with COVID and school health to have to be PHNs with the not just the RN but the baccalaureate also piece.
And Melanie says she is one now.
Oh, wait.
Melanie Landry.
Okay, I need, take her email. Take her
Melanie,
email.
send your email.
Melanie, do you want, are you willing to give me your email and WhatsApp here? I will give you my number to any of you for that matter. I would love for people that want to get in touch to connect via WhatsApp, and I will tell you why, and I always will ask permission. So that's my WhatsApp, sorry, +1 before. So it goes +1 before. And put your name, and what I will ask you when you send me, say your name, say I'm a PHN, and to others, other things if you want to share, because I need someone for the media. I want a public health nurse of the new PHNs. If of course you will need to ask your boss if they allow you, but most bosses that are good bosses will tell you yes. We need desperately a PHN of the new ones for media, for a media interview, because they want to hear from a frontline professional, which is great.
So Doris, it's we have just over 20 minutes left. So I'm wondering, I propose that we talk a little bit about what actions are needed to ensure just recovery for a few minutes, and then maybe Heather and Irma-Jean can help look at the chat box and find some maybe unique questions, if that's okay.
Yes.
Okay.
Yes. So let's ask first the colleagues. What is this thing, just recovery for all? What does it mean, or what is it, or where does it come from? Anybody that can share? Among 182 people we have, surely enough, someone will know. Not RNAO stuff. Just recovery for all. You can Google it. That's a tip.
We can give you the, we can unmute your line.
We can unmute your line, or you can write in your chat. Yes? Any takers?
Okay, Katrina is saying universal care regardless of age, sex, and culture. Umara is saying everyone should get fair share. World Health Organization. Marianne says the ability to mitigate systemic barriers and discrimination to care. Dania Versailles, hi Dania, is about putting people's, oh, I lost Dania's, about putting people's well-being first and overhauling an unjust system to ensure no one is left behind.
Okay, very good. So in a sense, all of the above, hence why we will not send you a book. I'm joking, I'm joking. In a sense, all of the above, with one exception that doesn't come from WHO or from United Nations or any of them, comes from 350.org, which 350.org originally and for the most is a very progressive environmental association. Worth for you to follow them on Twitter. Their CEO is brilliant. Each single tweet, you will be inspired. It's really inspiring. And they actually developed the Just Recovery for All. And it means that we will recover from this COVID, but we will bring everybody with us, not just some, right? Because then it's not just recovery for all. So they have 6 prong approach, and different organizations that join them choose which ones they will take if it's not the 6. And we actually focused on 2, and then we added our 3rd twist alone. And the 2 that we chose is 2 vulnerable populations. One that it is the housing for persons experiencing homelessness, and also the care of seniors, especially those residing in nursing homes. And then of course, we also added the 3rd one, which is the reenactment or the reinstatement or the whatever we call it, of Canada's chief nurse. And we started to lobby the federal government on that. And when you look at the throne speech, and if you heard the throne speech, we got 2 of the 3 so far. The issue of housing for ending chronic, this is how the Prime Minister called it, ending chronic homelessness. So the beauty of it is that they will work with co-ops. They will work with co-ops and not for profits. They will work, so that's very encouraging. Now, I have the people that speak here always and tell me things. And these people are telling me, words, words, words. Let's see that actually becomes action and it materializes into funding, funding, funding. So yes, for now it's words, words, words. But hopefully when we see the budget, there will be funding, 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 and that we will deal with that issue. The second is the Prime Minister spoke about national standards for nursing homes in Canada. Now, when you say national standards, you can right away hear the premiers taking the phone one to the other. We want the money, we want the money, we don't want any strings attached. So that's exactly what happened. Ontario, Quebec, Alberta, and I don't recall who was the fourth, cahooted together to, we want the money, we want the money, we don't want strings attached, because health is a provincial jurisdiction. Yes, health is a provincial jurisdiction, but years ago, there was such an initiative with primary care, and it was meant to move us to team-based care in primary care and to anchor the system more in primary care. And surely enough, that's when the country as a whole, or most of the country, moved from completely solo doctors and a few community health centers to a lot of more community health centers, family health teams. This is when RNAO pushed the issue of the nurse practitioner-led clinics, etc. So we are pushing for that, and we are saying national standards with strings attached, and I believe we have an action alert, right, Imogen?
About the national standards, yes, we're about ready to send it out.
So we will want all of you to write, and sign, because now is the time before it comes the budget, and now is the time to push both at the provincial and federal level that we want the basic care guarantee, which is part of that national standards. We're saying 2 things needs to go in the national standards. One is the basic care guarantee, and the second is evidence-based practice. So we are pushing for absolutely both issues. We know that the places that are doing the guidelines, we know that from an OECD report, are having better outcomes than the places that are not doing work with the guidelines. And if jurisdictions could get some support to implement the guidelines in their nursing homes across the country, or at least in many, they will be doing better. Staffing plus evidence produces better results, and we know that. So that is with the throne speech, and also with the issues of the 2 vulnerable populations, and of course the issue of the nursing chief for Canada. And we will continue to push, and I'm still very hopeful that before the December 31st, we will see that, because we said to the Prime Minister that the December 31st is the end of the year of the nurse. So it will be a nice way to celebrate. And maybe you want to review, Imogen, the nursing home basic guarantee?
Oh, yes, I certainly will. Yes, so the basic care guarantee has a number of different prongs. The first is the staffing, where we have a minimum of 4 worked direct hours per resident per 24 hours. And that includes nursing care and support work. The nursing care is provided in 48 minutes per day per RN, 60 minutes per day per resident this is, per RPN, and 132 minutes per day per resident for each PSW. So that totals then, if you're looking at the mix, 20% RN staff, 25% RPN staff, and then 55% PSW staff. In addition, we're looking for modernized health human resources standards so that staff are hired full-time. Their compensation, salary, and benefits is at par with hospitals. We're looking for harmonizing up to hospitals so everyone's at par. And there is offer of full-time work. We're also asking for an IPAC nurse, preferably an RN, and as well as NPs, one NP per 120 residents, and in places where NPs cannot be found to fill those positions, hire CNSs in those roles. And the NP should be an attending NP or the director of clinical staff. And then finally, a cadre of interprofessional staff that can provide many of those other needs that are required by residents. And all of this, we believe, will provide safe, basic care and begin to meet some of the higher acuity and complexity of the residents who are in long-term care. I hope I included everything, Doris. Did I miss anything?
Absolutely. Absolutely. I'm putting another request from another media that I just got. Here you go. It's there. So a nurse, I do need to tell you that it will need to be a RNAO member. Any nurse that we put in the media from RNAO needs to be a RNAO member. So not that I'm pushing you to be, but you should be anyways. Almost 45,000 we have. Morgan, cover your ears. Almost 40, Angela is there also, I saw. Angela certainly needs to cover her ears. Almost 45, this little from 45. So we need an RN that is frontline staff nurse, RNAO member that is willing to speak with media about being hopeful or keeping hope in the midst of the COVID pandemic. Ideally, someone that is a staff nurse. If you are interested, again, send me a WhatsApp. I did put before my number there. And I absolutely need that ASAP because the media moves very fast with things. I can put my number again. We are getting lots of requests for nurses for the media. We are constantly in the media, but it's exciting that they're asking about staff nurses and frontline nurses. And it's important that you guys jump into it because I'm doing 3 things at the same time and I am not sure even if I'm doing it right. No, I put a number. Here you go. Because, you know, the more that nurses are in the media, the more we can portray the image and the value and the importance of nursing. So please, 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 think if you're willing and able to do that. And if you are a staff nurse or if you are middle manager, by all means also. Excellent. What's next? So this is
Did you want to speak to this at all, Doris? And then we've got 10 minutes left.
So this is about nursing home, right? Again. And this is about, I already spoke about these pieces that is 21 years, guys. We have a report. Heather and the team put a tremendous report. 21 years, 35 reports. So it's not one, it's not two, it's all governments of all political stripes. The difference is that now we have COVID. Now we have COVID, it means we have an opportunity to do different. And if we don't succeed now, forget it. Forget it. Will take till the next pandemic 100 years, if. Because if in the midst of this mess, the government of the day and the rest of us are not pushing and getting the answers, permanent answers that residents in nursing homes need and deserve, then we never will get it. Because the disasters and the tragedies didn't happen just in COVID. It happened before. It has been constantly in the media. We have had endless numbers of reports. We just mentioned Gelis before, but there was Casa Verde, there was many. And Heather, if you can put the link to the report, people can look, or to the website. If you guys Google COVID-19 RNAO portal, you are going to see all the reports there. You will enjoy looking at that. But any of you that are interested in anything that is related to COVID, please look. So we need to push all the way. And Kathleen Picard, I'm glad that you say we will keep pushing. We need the 174 of you participating today and everybody else pushing together, all of us, to get what's needed. Thank you, Susan.
Great. Now, Ermagine, I think you had identified a question you want to ask, and maybe Heather, and then we should set up for the cheer. Ermagine, you're on mute.
Rhonda Seidman-Carlton, and she says our family health team has worked virtually since March, and it is rare to obtain an in-office appointment. Now we are hearing they are unsure if or how they can hold flu immunization clinics and still keep themselves safe. Could you speak to this?
I am responding to someone or to someone's because I'm not understanding what's going on the chat. So if people want to speak in the media, either send me a WhatsApp or send an email. Olivia, if you can put my email, or yeah, because I see a bunch of names and I am not sure if that was meant for the media or for what.
They're just wanting to be promoted to camera for the cheer.
Oh,
That's why
I was so excited. I was so excited. I thought, oh my gosh, everybody.
Yeah, be careful. If you put your name there, you might be asked to talk to the media.
We'll get it all mixed up.
I was so happy.
Oh,
Okay. Sorry, Imagine the question.
This was a question by Rhonda about the family health team. It's been rare to get an office appointment. Now they're hearing that the family health teams are unsure if or how they can hold the immunization clinic and still
Okay,
keep
so
safe.
thanks, Rhonda. Hi. Every single primary care site is their decision how they're doing. So I also belong to a family health team, and mine absolutely is going to provide the flu vaccine. They will provide it though, instead of in the usual place where they do, in the walk-in clinic, by appointment only. So you make the appointment before. So call your clinic and see, because each one of them is doing something different. Each one of them is doing something different. And there is no mandate for them to do anything, because remember, they're independent practitioners. Hence why they put, by the way, the pharmacist. It was not just a nice thing to do. So different communities also are doing very innovative initiatives. This is truly in the positive side of things. In East Toronto, which Rhonda knows East Toronto because her daughter lives in this area, and I live in this area too. They are doing amazing work even for supportive housing, where teams will go to the supportive housing to give the flu shot. So really, there different communities are doing fantastic things. And if you Google, what's the name of that lean, of that BPSO lean, OHT, Susan, is Toronto East Partners?
Sorry, East Toronto Health Partners?
Yes. So if you Google Doris Block East Toronto Health Partners, you will see the entire plan of what they're doing, and you can use it for other OHTs and to influence. It's phenomenal what they're doing with the flu. Yeah,
And
they're
actually,
really,
someone's saying they're having a flu shot in the doctor's office parking lot.
here you go.
Some of the work we've been doing, the clinics are being urged to partner with home health care. Couple of clinics partnering together.
Very good.
So I think engaging home health care is really
Critical,
an
critical.
important way to do it. Yeah. Oh, we have a cheerer.
How are you, Bryson?
Good.
That is very good. Are you going to cheer with us?
And Olivia is just promoting people to
I
screen.
have no
So
idea.
You
there might
have
be
no
time for one more
idea.
question.
And Doris, one of the comments was that they're wondering maybe potentially as people are having their COVID tests, maybe that's an opportunity to do their flu vaccinations at the same time.
Yes, the issue is that now they're not, you mean when they go and do that? Yeah, that would be brilliant, actually,
Yeah.
right?
Because they can
Yeah.
get them both in the pharmacy now, right?
If they don't have symptoms.
Yeah, yeah.
Yeah. Very
But just trying to
good.
think of increasing access to the flu vaccine.
So it's very localized how they're doing.
Yep, yeah, clearly, yeah.
Yeah.
Yeah. But I think once somebody starts, it might really catch on, some of these innovative things. So we have to keep promoting it.
Yeah, I only hope that we will have enough flu shots as the demand will be. Because if it goes like the test, that we already don't have enough, that will be a problem, because actually it's very important this year, the flu shot. I know they bought a lot more than usual, I believe 3 times more, but I think we will have a huge, huge request by people, which is good. Yeah, very good. So should we bring elements, or what are we doing?
Elements.
Elements.
That's a pretty classy name for a pot and pan, Doris. Elements. I love it. I just have a pen and glass. Oh.
Okay, there's room for maybe one more cheerer.
For the flu shot or what? For the
Well,
check. Okay, we go. 1, 2,
so you can
3.
unmute yourself.
Yes, everybody to unmute.
What are you gonna say?
Olivia, you're muted.
Say, get your flu shot.
Get your flu
And
shot.
Jacqueline is muted.
Get your flu shot.
I'm gonna say the opposite.
No, you gotta say get it.
I'm gonna say the opposite.
Oh, you're gonna get kicked out.
Listen, are you missing a tooth?
So many teeth.
I just saw it.
Are you showing
Wow.
Okay.
Okay, here we go with a toothless.
And cheer for teeth.
Go get your flu shot.
Yeah, get your flu
I'm gonna
shot.
say the opposite.
Get your flu
You're gonna get
shot.
double flu shot then.
Flu shot. Get your flu shot.
Wow.
Stop COVID too.
Don't get
For everyone.
Get your flu shot.
Get your flu shot.
The flu shot.
Yes.
You're
silly.
Lovely. Excellent. Thank you,
Okay,
everybody.
good
Okay,
night.
thank you, everyone.
Thank you.
Thank you, Doris.
Bye.
Good night.
Bye. Bye.
Bye-bye.
Stay safe.
Thank you.